Hello, everyone, and welcome to RPNAO's de-escalation webinar series. This is webinar number 3, entitled Managing Conflict.
So today's webinar is going to look at managing conflict, as I said, and some of you may not have participated in the previous de-escalation webinars, but that's okay. So I'm just going to recap a little bit to start, and then we'll get into it a little bit more. In session 1 of the de-escalation webinars, Recognizing Potential for Conflict, we learned how to recognize conflict and why behaviors may escalate. We learned that people feel they have a lack of control, lack of dignity, a fear, or maybe a lack of understanding. And then the second session was about communication techniques, and we learned about body language and how we say what we say. We talked about how to use our words to potentially de-escalate a person in crisis. And again, these are just basically tools and resources for you to use. It may not always work in every situation. Managing conflict is the final phase for the de-escalation, and it's our third session. And today we're going to learn how to recognize when the situation is de-escalated and the importance of prevention, of using coping strategies for further prevention. The goal during de-escalation is to diffuse the situation using tools such as listening, distraction, and remaining calm are useful resources. But how do we know our techniques have been successful? When the person in crisis stops the aggressive behavior through calmness, beginning to cry or apologize for their behavior, it is safe to say the situation has been de-escalated. The person in crisis may be more coherent and willing to talk about why they are upset. Through this, we gather useful information for further prevention. Remember to allow them to talk about their crisis but remain calm, and show that you are listening without distraction. For a dementia patient, to recognize when they have de-escalated, they'll stop what they're doing and move on to something else. So an example that I have today is that when I first started nursing many years ago, I worked in a long-term care facility. And I looked after a resident, we'll call him Bill today, and he would just get upset without any warning. He and his wife shared a room, which was a really nice setup for them, and he was never, ever aggressive towards her. So one morning I was providing Bill's AM care, and he suddenly became upset. He put my head in a headlock, and I honestly thought that my head was going to go through the bathroom door. I braced myself, and this was before I knew anything about any prevention techniques or de-escalating a situation. And at first I panicked, and then I thought, oh my gosh, like this is it. So Bill was like a really small man, and he was like extremely strong because he had worked, he was a farmer all his life, so he was used to, that physical labor. So finally I just said, Bill, you're hurting me. And at that moment he let go, and he said, I'm sorry, dear. It was so, it worked out great for me. But, he I guess didn't realize, but I said it in such a way that I wasn't yelling at him, I wasn't being aggressive towards him, so he didn't feel threatened. And it was really helpful. And I've never forgotten that, and I've used it since then. So after that, Bill was really calm. He didn't get aggressive towards me, during that time, and I was able to provide his care, and and that was like exhibiting that he was de-escalated in the situation. What happens next? We recognize the situation is in control because the person is calm. Our goal is to prevent this behavior from reoccurring. Therefore, prevention measures need to be in place to manage conflict and prevention of reoccurrence. How do we know what these measures should be? The prevention measures will not be identical for every person. So as individual as their behavior, the preventions also need to be individualized. Before we can actually put the preventive measures in place, we need to set limits. Setting limits are an important part of the process because we do not want the person to start escalating once they have calmed down. Reassure the person that you are there to help them, but in order to do that, they need to remain calm. You need to say that in order to put preventive measures in place, you need a better understanding of why the behavior occurred. So this is the opportunity to work together and prevent this from happening in the near future. We need to remember when setting limits, we are to make sure they are reasonable, enforceable, and clear and concise. So how do we set these limits? Give options. For example, say to the person, if we talk about this, maybe we can come up with a solution. I'm willing to listen. This reinforces that you are there to help them. It also involves them in their care and future prevention. Follow through with what was stated. So once the person is calm, then the activity may continue. So let's say that in this situation, somebody is escalated in their behavior, but you're waiting to start an activity, but you can't because of their behavior. So you let them know that when they have calmed down, then you can continue with what was supposed to take place. Or maybe it was the actual activity that escalated their behavior. If they don't want to participate, they have this window of opportunity to say why they don't want to participate. An alternative may be available for them. Change the limits if it fits the situation. For example, saying we can continue with an activity and we have found out the activity is the root of the escalated behavior, we can change the plan to something more desirable for the individual to participate in. They are still involved in an activity, but feel less agitated about it. Plus, they've also been involved in making the decision as to what they want to do. In the Communications Techniques webinar, we talked about how to use verbal and nonverbal language to de-escalate the situation. We need to use these techniques to set limits, or the person may not be cooperative, causing the situation to worsen. Remember that what you are saying without words, when you are speaking to the person, how you are speaking. What is your tone like? Are you speaking at the right speed? And can the person hear you? We also need to be aware of our nonverbal communication. What are you saying without words? Are you relaying a message of trust and attentiveness? What is your posture like? Always remember to be non-judgmental. Keep in mind that this problem is real to that person. This allows a positive and safe environment for them to express their feelings. Allow for silence. This shows that you are actively listening. Use restatement for clarification. This way, you will have a better understanding of exactly what's going on. Listen for the facts and how the person is feeling. This is important when we use coping strategies for further prevention. We're going to talk about CPI's coping strategies later in the presentation. Right now, we will watch a video. This video is a great example of the techniques we have talked about. It is a law enforcement video, however, it can be applicable to healthcare or in any situation.
No, you're lying, you're lying.
On a mental health crisis call, there are specific actions an officer can do that will escalate the crisis or that can de-escalate the crisis. When you understand what you can do to verbally de-escalate a situation and practice the skills to actually calm a person down, the situation is safer for you, safer for the person, and safer for the community.
12 minutes, officer needs assistance. 2700 County Road 2. Officer needs assistance.
When arriving on the scene at a mental health crisis call, you are immediately assessing the situation for your own safety and that of others. You also want to assess quickly how the person appears. Does the person appear angry, confused, or in some physical pain? What is the person doing, and what is the person saying? The first step is active listening. Introduce yourself, explain why you were there, and ask the person's name.
Hey, I'm Joe. I'm from the Sheriff's Department. I'm here to help you. Well, what's your name?
Be brief with your responses and let the person know you are listening.
Get rid of him. Make him go. Hey, I hear you.
Asking closed-ended questions that begin with do you, can you, will you, and so on will not get you the information you need to understand how to help.
Can you tell me what's bothering you today? No! Okay.
Open-ended questions get you more information. They're similar to how you would write a police report, detailing who, what, when, where, why, and how.
Mike, what's got you upset today?
This old man won't leave me alone. He keeps calling me names and he won't leave me alone. Shut up! He won't shut up!
When you pick up clues in the person's comments, respond back showing you understand how they feel.
I can hear anger and fear in your voice, and I can see that it upsets you.
Reflecting back what the person has said to you, either exactly as they said it, or paraphrasing in your own words, also shows that you are listening and understand.
Okay, so you can see and hear an old man. He's yelling at you and saying awful things to you, and you can't make him go away.
You can show empathy toward another through your body language and your tone of voice. People in crisis respond to these cues at a very unconscious but emotional level.
I can see that you're scared. I wouldn't want some voice telling me those things either.
Developing rapport with someone means the ability to now have an honest give and take conversation. Avoid arguing or feeding into delusions.
You see him, don't you? Just, can you take him away?
Okay, I got to admit, I can't see or hear this old man, but I believe you do. And I understand you're scared because you can't make him go away.
Be honest about what you're going to do and explain procedures before you do them in very simple language. Remember that understanding will take time when a person is in crisis. Watch for the physical signs that a person is calming down.
Okay. We've got some options. I can bring somebody in. We can go somewhere. The only option that I don't have is I can't leave you here alone tonight.
Give the person time to choose one of the acceptable options. It will take a person in crisis longer to process what you say. In the end, you're looking for the person to willingly agree to the safest course of action.
Okay. So in this, first of all, I just wanted to say that Julie had said about allowing time to vent, and that really is important. The police officer uses restatement in his own words to show he's listening. He's honest about not seeing this other person, but the way he presents it, it's just so great to that person because he tells them he believes that he can. And the police officer remains calm the entire time, and then, which, you know, that we've talked about that, and it's key in de-escalation. The outcome is that the man calms down. The police officer sets clear and concise limits that are enforceable and reasonable, and through letting the person in crisis know that he will not be leaving alone. You know, so, you know, yes, you're calm, but he's going to be leaving, and that the police officer will be with him, and, you know, that it's all good. He feels safe, and he wants the man to feel safe. And just as the man wants to feel safe himself, and he clearly demonstrates the feeling of being unsafe through his distress.
Yeah, I'm really glad to see everyone chiming in about the video. I thought it's a great example as well. Grace, I just wanted to address your comment about law enforcement learning more about de-escalation. And it may be true that you heard it was in Calgary, but I know here in Toronto, in the East End, Toronto East General Hospital actually has a mental health nurse who is part of a special law enforcement team. We can get you the exact acronym, but I think it's like a mental health crisis intervention team. And so it's a nurse who is on the team along with a couple of police officers who are essentially first responders in mental health crises. So you're right, it is good to see law enforcement learning more de-escalation, but even better to see that interprofessional collaboration in terms of being able to support patients. We do have time at the end for more comments and questions, but I just wanted to address everything related to the videos specifically. And don't worry, we won't forget about you. I see lots of you chiming in there, and we'll get to all of your comments. So hold your thoughts.
Okay, so remember in the communication techniques webinar, we said that it is important to speak genuinely and calmly and use restatement, don't yell, stay in control of your own behavior and the fight or flight responses. Also allow the person in crisis time to process what has been said to them. So in setting the limits. So the police officer demonstrated that as well, because he would say something and he would wait for the response. He wasn't throwing a whole bunch of information out there at the person in crisis, which is really important. So he wasn't feeling overwhelmed and he was able to de-escalate easily. So now we've moved to the prevention stage. It is important to still maintain these forms of communication so the person in crisis will trust you. The person in crisis and the caregiver work together to prevent this behavior from reoccurring. Both people involved in this crisis need to have a mutual respect and mutual dignity. This way, you can work easily together and keep the situation de-escalated. If there is any deviation from the limits, then there are consequences which you need to make clear. So an example of this would be if there's a patient in an emergency department that's upset and abusive towards staff, then the healthcare provider has de-escalated the person through the use of communication techniques, and there were no restraints, no physical or chemical restraints used. The patient should be told that you are now calm, so we can proceed with helping you, because obviously that's their main goal because they're in an emergency department. However, if you start striking out again, this will delay the process. So you're not saying, I'm not going to look after you. You're just saying it's going to take a little bit longer. So this is a clear set limit. Communicate it to the person, relate it to their behavior. It's reasonable because the patient, is having an outburst of behavior. They will not receive the treatment and that they may be looking for in a timely manner. Conveying this message is a respectful way, and directing the consequence to the specific behavior makes the message concise. You are also stating the patient will receive help because their behavior is under control. Providing reasonable choices to the patient also puts them in a position to make their own decisions so they feel in control of their treatment. It provides alternatives to the potentially violent behavior. The healthcare provider can also provide realistic choices, such as, maybe a magazine or a glass of water, a cookie, as long as, these are acts of kindness that assist in keeping the person calm. Remember to be honest. Do not offer something that you can't deliver. So let's say the person wants to go outside to smoke a cigarette. Because it's not hospital policy to smoke on the property, that wouldn't be very realistic. Or there may not be an available person to go outside with them, so that would be unrealistic. So keep it realistic, keep it within your means, and provide that trust for them and a good rapport. Building a trust with the patient who is now calm without the use of chemical or physical restraints empowers the patient to stay in control. In turn, it can be beneficial to the patient to seek help earlier in a similar situation, meaning because they feel they can trust the healthcare provider, hospital and staff overall, They will most likely avoid I've lost my words. Most likely avoid further agitated states through getting help when the situation first starts. So we talked about how to communicate with the person in crisis, build a rapport. The healthcare provider can now gather information to strategize, to find out triggers, to come up with a plan to prevent further conflict and to provide support. CPI uses COPING, coping, for management of behavior. The situation is under control, so the person in crisis is calm, their emotions are stable, and they're willing to communicate rationally. Now the healthcare provider can orient. So this includes gathering the facts from the person. Their interpretation may be quite different from what we observe, so it is important to really listen to their facts. When gathering the facts, remember to be non-judgmental and think of what could have been done differently to de-escalate the situation sooner. So if possible, see if there's a pattern, which is the P, or a trigger. It could be a certain time of day, it may be a certain visitor, or it could be that they have an infection. Often elderly people who have periods of confusion and it is not their normal behavior, they might have an infection. Maybe an old chart is available. Ask a family member when possible if a person has had any other incidences of a similar nature. Finding the origin of the behavior is key to further prevent. Or see if there are any interventions in place for this person. Previously, such as in a mental health patient case, this patient may be one who has been admitted to the mental health unit before. When the patient takes their medication on a regular basis, such as dispensed by the nurse, then their behavior levels out and they are not at risk for being violent or escalation. However, when they have been discharged from the hospital and are still followed by the doctor, they may tend to stop taking their medication because they feel better. This is a pattern. So when we know their possible pattern, then we need to investigate and look for alternative interventions. Perhaps the person lives in an environment where they will not be monitored about taking their meds. Maybe they need more frequent visits with the doctor or other members of the interdisciplinary team, such as the social worker. The team can work together to provide frequent counseling to the patient, so that they understand what could happen if they stop taking their medication. Through investigating, you may discover alternatives to the behaviors along with resources to support them. Investigating and finding out alternatives are great, but it is the negotiating between the healthcare provider and the patient that will resolve and/or prevent further crisis. In the case of the elderly person who might have an infection, perhaps teaching with the patient and their family that as soon as the person exhibits signs of infection, such as night sweats, nausea, decrease in appetite, and so on, they need to be brought to a clinic to have blood work or urine tests, therefore preventing the escalated behavior before it occurs. In the case of the mental health patient, providing a clear understanding to say, without taking your medication as prescribed, this could lead to you becoming worse, and until you can be trusted to take your medications, you need supervision. Also, they need to make sure that they attend all scheduled appointments. The patient needs to agree to changes, so to be sure, make reasonable requests. This is like signing a contract, and in some cases may be necessary to sign a contract to actually provide the desirable outcome of prevention. The contract should also outline any consequences if applicable. Lastly, give support. This is making sure you are available to help the person with the transitions for change. The support provides encouragement that the person can achieve the goals and prevent the behaviors from reoccurring. Providing ongoing support ensures the person will follow through with their negotiation agreement. Remember to thank the person for being cooperative and coming to an agreement that best suits their situation. The objection is prevention to achieve this need to management conflict. So in conclusion, to recap session 3, RPNAO's de-escalation webinar, Managing Conflict. The goal is to successfully de-escalate a person in crisis. We want to prevent the behavior from reoccurring, and we want to implement a plan to support prevention with this person. Recognize when the situation has been de-escalated, then set limits. Use proper communication to keep the situation de-escalated, gain trust, and have a rapport with the person in crisis. Let them know there may be consequences if their behavior becomes escalated again. Remember to offer reasonable choices. This builds the trust and provides a good rapport with the person. Coping, or the COPING, used by CPI, is when you have reached a controlled situation, you have found out the facts, you can implement a plan and negotiate with the person for further prevention. Remember, giving support is key to sustain the behavior. So I'd like to finish the webinar today with another video. And the video helps us to realize and think about how we might perceive someone, and finding out their story is how we provide the support they need to prevent a potentially violent situation. Okay, so that concludes our webinar for today, and I wanted to share that video because I think it really has a great impact as to how we may perceive someone without actually finding out what their real story is. So potentially, if we, regard them as, as they've labeled them in the first half of the video, our approach is going to be different, and it may escalate the situation. So really finding out what their story is can prevent any escalation. Yes.
So I think that's it for this afternoon. Thank you again so much for joining us.
Absolutely. Everybody take care, drive safe.